Human beings are a social species that relies on cooperation to survive and thrive. Understanding this ideology is how, as a society, we have recovered from disasters and also how we have improved as a community. Through human cooperation, strategic planning has been done, deliberation has led to improvements in the fields of engineering and in technology, and people are focused on ethics and morality. Cooperation shows that more minds are better than one. However, most recently threatening human cooperation is the COVID-19 pandemic. COVID-19 is a mutated strand of the widely known coronavirus. There are currently 7 known types of coronavirus that can affect humans. However, the exact origin of the mutated strand has been widely deliberated. Generally, though, most place the origin at the Wuhan market in Wuhan, China. The virus typically has a period of 2 weeks, specifically 2 to 14 days after contraction, where it can be spread but the host is asymptomatic. However, the indicator symptoms, as stated by the Center for Disease Control and Prevention, the CDC, are a lack of taste, a lack of smell, fatigue, headache, cough, and fever. This allowed for an initial outbreak as it was not known about prior to the few first cases appearing. As a result of this 2 week period, those that were infected moved around the country, and China's resulting response was an initial quarantine that housed a total of 36 million people. It is to no surprise that the COVID-19 virus was able to travel into new countries around the globe because of the 2 week dormancy period. The fastest and hardest hit early by the virus was Italy. This was because Milan, Italy, was a business hub and had many close connections to China. Equally, the country of Italy is known for its close proximity to one another and has one of the oldest populations. Therefore, a virus that is spread through direct and indirect contact and targets those who have underlying medical issues had the ability to run rampant. Although the country struggled early due to a quarantine period where extremely small portions of people went outside at a time, the country was able to achieve normality again. Although not every country has had the same success. Many have criticized nations for not responding quick enough and with adequate caution, affirming that with the proper care, a pandemic could have been avoided. This being that there were not enough tests, that there was no plan for disease control, and that schools and businesses remained open while cases soared. Equally, many have stated that the response was necessary and that the cases rising was a sacrifice to prevent an economic shutdown. However, in its current state, cases are rising and provisions are being put in place to stop the spread of the virus. There have been many propositions as to how to limit the spread of COVID-19. However, the most popular and considered the most effective is the stay-at-home order. The stay-at-home order is a proposition in which a state or a country puts its citizens under a sort of house arrest, stating that it is safer at home and that all non-essential activities and non-essential travel should be halted, as if people are not outside, they cannot get the virus. Many governments followed the policy of emergency management, which is learning lessons from others in similar circumstances. Therefore, because of Italy, many state-mandated or government-mandated laws were put into place to limit the spread of the virus. However, the effectiveness of these provisions is widely debated. Many state that this initial reaction was not taken seriously enough, and for that reason, the virus has ended up as a pandemic. Ideas such as masks, remote work and learning, and the stay-at-home order have proven to be successful in preventing the spread of the virus. However, the stay-at-home order comes with the flaw of limiting social interaction between humans. Social interaction includes the acts, actions, or practices of two or more people mutually orientated towards each other, this simply being through communication. On the other hand, social isolation is an absence of social interactions, contacts, relationships with family and friends, and individuals at large. Social isolation has been linked to many types of developmental issues, many of which are related to mental health. The stigma around mental health has long been negative, highlighting society's perception of perfection. However, mental illness is real, and most notably and commonly diagnosed is depression. Depression itself is classified as feelings of severe despondency and dejection. There has been pressure for mental health to be acknowledged and for healthcare facilities to provide adequate treatment for mental health issues. Similarly, with the impact of the COVID-19 pandemic, self-isolation may have taken a toll on the amount of mental health cases. This is because individuals do not have access to social interaction and therefore cannot openly and freely express emotions, feelings, and live socially. As the quarantine period continues into the foreseeable future, there is controversy over the implications of the stay-at-home order. While many state that the order is necessary for the country to recover and beat the pandemic, many also argue that the stay-at-home order takes away from the poor, the disadvantaged, keeps children and others in abusive households, and limits social interaction, which is necessary for mental well-being. The stay-at-home order poses the question of whether it is more important to preserve a country as a whole or to protect those that are liable and susceptible to danger as a result of quarantine. Now I would like to introduce my colleague, Samantha Taubman, who will be elaborating on the problems associated with the stay-at-home, stay-in-place order.
Though the stay in place order and isolation periods mandated by city and state officials have good intentions, the unintended consequences of these actions have been costly to both the collective and the individual. Humans as a species are social creatures. We thrive in social settings, and for those of us who don't enjoy those scenes, the company of one other person can be just as comforting. Without any interaction with other people or even living beings, the effect on a person's mental health can be catastrophic. According to an article by The Scientist, a critically acclaimed science journal focusing primarily on the life sciences, it was found through several experiments focusing on the effects of extreme isolation periods, often lasting around 6 months to a year, that people routinely report confusion, changes in personality, and episodes of anxiety and depression. While the isolation period we've all been experiencing may have not been as intense as space missions or being holed up in a cave for 6 months like French scientist Michael Serfet, the toll on mental stability observed in those studies have been notably seen in those experiencing the COVID situation by themselves. Renee Goodwin, an adjunct professor from Columbia University's esteemed Mailman School of Public Health, reported that in the U.S. from 2005 to 2015, depression rates soared from 6.6% to 7.3%. Notably, the rise was most rapid from those ages 12 to 17, increasing from 8.7% in 2005 to 12.7% in 2015. That was 5 years ago. Since then, the organization Mental Health America has reported over 9.2% of youth, over 2.2 million youth, cope with major severe depression. This jump in numbers throughout the past decade is not only worrying, but a warning signal for what is to come due to the extreme isolation. As stability and security are being torn from Americans' hands due to the unpredictable manner of the virus and the extension of the stay-in-place orders are increased, the depression rates will only continue to skyrocket. Depression isn't only a mental burden on the person, but also poses a serious threat to physical health. According to Dr. Julianne Holt-Lunstan, a professor of psychology and neuroscience at Brigham Young University, a lack of social connection heightens health risks as much as smoking 15 cigarettes a day or having alcohol use disorder. She's also found that loneliness and social isolation are twice as harmful to physical and mental health as obesity. Since the number of those diagnosed with depression have been increasing over the past decade, a large number of those impacted by this mental illness are not only at risk due to their heightened state of emotions, but also more likely to be suffering from the health repercussions associated with loneliness that Dr. Holt-Lunstan studied due to the mandated isolation period. The unprecedented impact of the stay-at-home order has taken on Americans' mental health is staggering and an unwarranted attack upon those people affected. Both state and local governments need to come together to resolve this alarming issue that will only continue to grow as we approach a half year in quarantine. Further casting doubt as to why the stay-at-home orders are beneficial, the issue of children trapped with their abusers throughout the quarantine period has become a heated point of contention. As schools and offices have now been closed for months, with only a small percentage of the original population returning to in-person, those who rely on these places as a safe haven from their abusers no longer have that sanctuary. In fact, according to Child Protective Services, in the fiscal year of 2016, CPS received reports of 293,140 allegations of abuse. Of those, 56,980 cases, or 19%, were reported by a school employee. With that astounding number of educators being the ones to discover cases of child abuse, it is painful to think about the number of children whose abuse has been unregistered by those who could have potentially gotten them out of that situation. With victims being stuck with their abusers for what has now been months due to COVID, the number of people calling any child protective hotline has greatly decreased. As reported by the Washington Post, in the nation's capital, hotline reports of abuse and neglect between mid-March and mid-April were 62% lower than in the same period last year, according to the D.C. Child and Family Services Agency. While this may seem like a good thing, an occasion to celebrate, the consequences tell a far more harrowing story. The cases surfacing often involve children so severely injured that they end up in the emergency room and intensive care unit. In some hospitals, they are dying at an unusually high rate. This disturbing trend being observed throughout the nation as schools and other settings victims take refuge in remain closed due to the government mandates is an appalling narrative. Not only are the current cases of abuse a revolting display of the worst of humanity, but the long-term effects are also of critical concern, with physical health consequences such as high risk for diseases such as diabetes, cancer, and stroke. The psychological consequences are just as distressing. Impairments to the brain's executive functions, working memory, self-control, and cognitive flexibility, a risk for depression, anxiety, and other psychiatric disorders throughout adulthood, and the development of post-traumatic stress disorder are only of the few consequences reported by the government's Child Welfare Information Gateway program. As the stay-in-place order is further extended and schools are forced to move online rather than in person, the undetected child abuse will only grow worse. As we are seeing from the reports made from hospitals and hotlines, victims are trapped with no escape, no help in sight from those who would have reported these cases in the past. The lockdown may have had the best intentions in mind, but the fact of the matter remains. These past few months have taken a heavy toll on society's most vulnerable. Depression rates are skyrocketing, and due to the long isolation periods, victims are trapped with their abusers. Change or assistance must be provided.
Due to COVID-19, more and more people are being told to stay at home to practice social distancing. In addition, people who have tested positive are further limited to social contact through self-isolation. While it's important to take care of our physical health, it's also important that we take care of our mental health. Even though the stay-at-home order can cause many problems like depression and kids being stuck at home with their abusers, there's many ways that we can prevent and decrease this by practicing self-care. Here's a few solutions. If you're getting abused, call the National Domestic Violence Hotline. They're on 24/7, 7 days a week. You can either call them, or if you're unable to speak, go to thehotline.org. It may be overwhelming during this time, but taking the time to manage your health and wellness, it can make a big difference in how you feel. If you know someone who's getting abused at home or anywhere else, here's some ways that you can help them. You can let them know that you're concerned about their safety and that you're there to support them. Be honest and tell them about the times that you were worried and you want to help. It's not easy talking about this topic, so be patient with them. Help them make a safety plan. This could be packing important items and making a safety word that they can use to call for help if the abuser is nearby. You can also agree on a place to meet them if they need to leave in a hurry. Here are the statistics updated annually since 2004, representing the number of calls on average per day and during the holiday seasons. In 2017, there was an average of 730 calls per day, increasing in 2018, which then 801 calls per day. There's also online therapy. So what is online therapy? Online therapy or online counseling is the provision of professional mental health counseling service through the internet. These services are typically offered through email, real-time chat, and video conferences. In the past 30 years, researchers have conducted clinical trials involving tens and thousands of patients with excellent results. The platforms that you use will need to follow a set of federal guidelines called HIPAA, the Health Insurance Portability and Accountability, which ensures that the health information stays between you and your doctor. If you're looking for an online therapist, here's a few recommendations. There's Amwell. It's secure, it has a variety of therapists, and allows you to hide your screen. So it's officially recognized by the American Telemedicine Association, meaning that you are assured that your information is kept safe and that your sessions are private. So there's no recordings of the sessions. What is said stays in the session. Amwell also provides more therapists compared to any other online counseling. In 2019, they had a count of 465 nationwide. So you're most likely to find the one that you want. So they also have unique video systems that make therapy feel like a traditional in-person therapy. You can hide your face during that therapy. This is just one of many other great therapy services out there. There's also MD Live or Doctor on Demand. Something good about online therapy is that they're more accessible and they cost less. Some other easy solutions include communicating with each other as much as possible. So hanging out with friends through online applications like Zoom, Netflix Party, Google Hangouts, or FaceTime. You can host a happy hour with each other and drink some boba during that time. 5 to 10 minutes a day will do. You can also make a schedule or a checklist. You can use a planner. So study shows that following a routine can increase your happiness level and increase productivity. It can also help ward off depression. Even though we don't have school right now or work, it's important to have a regular schedule. So have a set waking and sleeping time. Eat your meals regularly, and this can help you make you feel more productive and feel more accomplished. Also, staying active. So quarantine doesn't mean you need to stop exercising. Exercising can help reduce stress levels as well as releasing endorphins, which increases your happiness level. Because of COVID, companies like Down Dogs and Core Power Yoga are offering free or discounted classes. You can also stay off your phone once in a while. Although it's good to stay up to date on what's happening outside of your house, too much news can increase your stress level and anxiety. If you're feeling overwhelmed, try putting down your phone and relax. Set a time limit on how much news you read a day. There's also many platforms that allow you to set a parameter on what you can read. You can also enhance your knowledge during this time. Watching TV is an easy way to pass time, but reading a book or listening to a book can increase and strengthen your imagination skills. So giving your brain a time to relax and get away from reality. Research shows that 6 minutes of reading can lower your blood pressure and ease tension in your muscles. There's also therapy animals. Getting a therapy dog or a pet can help with depression. Pets have a calming effect. By petting a pet, it can improve your mood. Touch can also release oxytocin and reduce cortisol levels, which are both stress-related hormones. According to Sandra Barker, a professor of psychiatry and the director of Center for Human-Animal Interactions at Virginia Commonwealth University, studies with therapy dogs suggest that even brief interactions with the animal can ease anxiety and fear. So these are some ways for self-care. Although it's important for to be physically healthy, our mental health is also a big part of our wellness. Thank you.